Hey everybody, Dr. Nick Scotto with River City Physical Therapy, located right here in the heart of Jacksonville. Today I want to talk to you about the top 3 most common signs and symptoms of lateral hip pain. Now, lateral hip pain has many diagnoses, and that includes hip bursitis, gluteal tendinopathy, glute pain, or even you may have been told that you have a greater trochanteric syndrome. So there's a lot of medical terms that are thrown out to diagnose this type of pain, but for the simplicity of this video, we're just going to call it lateral hip pain. So the hallmark sign of lateral hip pain is that you have pain when you lay on the side of the hip that hurts. So if you have pain on your right hip and you go to sleep at night and it's hard to fall asleep and you can't really lay on that right side, that's the number one sign, that's the number one most complained symptom that people have when they come to see me for this condition. So pain with laying on the painful side. Now, another common sign or symptom that people have with this condition, this lateral hip pain, is that especially runners, dancers, people who are very active, your CrossFitters or your weightlifters, they tend to have this pain when they are training for whatever specific sporting activity they participate in. So they don't necessarily have pain when they're sitting down. The pain occurs when they get up and start moving around, and it usually happens like middle to end of the workout, not necessarily right away. In worst cases, the pain comes on right away, but usually it comes on towards the middle or end of the workout. And they may have like an aching pain that kind of persists even after the workout. So pain during activity is another common sign that people have. Again, with this lateral hip pain, you're going to have pain not when you're just sitting there or just standing there. You're going to have it mainly when you're moving around. Now, the third common symptom that people have is that they can point to, with usually 1 or 2 fingers, where their pain is. And when they press on the side of the hip, where that bony aspect is on the side of the hip, that reproduces their pain. They either get a really sharp sensation, or they really get like just a hard ache, a hard dull ache in that area where their pain is. So the ability to really pinpoint where the pain is can give some more clues into whether or not this is true lateral hip pain or not. So being able to reproduce the pain by pressing the side of the hip. So just to recap, if you have true lateral hip pain and it's not a pain coming from the back or the SI joint, sacroiliac joint, you'll most likely have pain when you lay on that side. So if the pain's on the right side, it hurts to lay on the right side. You'll most likely have pain during activity, whether it be CrossFit, running, weightlifting, dancing, or participating in your specific sport. You usually have pain during the activity, and usually after it aches as well. And then pain with specific pressure to the outside of the hip. If you have any of these signs or symptoms and want to learn about how to get rid of this pain so that you can perform at a high level with your dancing, with your sport, with your exercise, your CrossFit, or your lifting, or your running, give us a call at 904-566-7070, and we'll be happy to talk with you to see exactly what's causing your pain and what's keeping you performing at the level that you want to. Look forward to hearing from you soon.